we're going to come up to our hands and knees, getting into a quadruped position. Now we're going to come back at the end of class and we're going to reassess that breath. Hopefully through doing a good amount of joint mobility, we're going to find that that breath actually improves significantly from the beginning of the class to the end of the class. Coming into quadruped, we're going to spread our fingers nice and wide, ground palms, extend the elbows fully. I want hands directly under the shoulders, knees directly under the hips. We're going to tuck our toes underneath. I want to feel that big toe tucked as much as you can. Feel a little stretch into that big toe space. Get some of those other toes tucked underneath as well if you're able to. We're going to start with some wrist mobility and then we're going to do some foot mobility. Then we're going to get into pelvis and spine. So starting with wrist, we're assessing both wrists, right side, left side. I'm inhaling as I rock back, hips into my heels. I'm exhaling as I slowly rock forward, loading into the wrist space. Inhale, unloads. Exhale, loads. I want to make sure we're not pushing into pain. I want to notice, how does this feel on the right wrist compared to the left wrist? Is one side stiffer, tighter, more restricted? Is it a little uncomfortable? And we're just going to do about 5 to 10 reps of each movement. Once we're done with our rocking forwards and backwards, we're then going to turn fingers out to the side and we're going to do a little bit of side to side glide. Now with this side to side glide, I like to have a push and pull effect. I'm pushing through away from one palm as I'm pulling in with the other palm. And we're moving side to side. My breath is inhale at the center. I'm exhaling as I move over a wrist. Inhale to center, exhale over the wrist. I'm still maintaining my 5 to 8 second breath count. I want to move slow. And I want to notice, how does this feel, left wrist compared to right wrist? Once we get 5 to 10 reps, now we're going to turn those fingers all the way back towards the knees. The closer the hands are to the knees, the less intense this is. The further out we walk, the more intense. I don't want this to be super intense. So we're going to pull them back towards the knees. I want the palms rounded. I want them touching the floor. We're inhaling as we rock forward on this. Exhale as you let your hips sink towards your heels, loading into that forearm space. I want it to be a light load. I don't want this to be a massive stretch. I want to be moving within what feels comfortable. I like the word juicy. I want it to feel like a good, juicy stretch. I don't want it to feel stressful. And again, notice the difference, right side to left side. On this particular movement, it is not uncommon for your dominant side hand, the forearm, to feel a little bit thicker, tighter than the other side. So that is expected. Once we get our 5 to 10 reps, we're going to flip the palms upside down to the back side, and we're going to let the elbows bend a little bit. Now, this position can be a little uncomfortable if it's your first time doing it. So let that weight be in your legs and less on your hands. From here, I'm really wanting to assess the elbows more than anything. So we're going to lightly press into the floor to extend the elbows. And we're seeing, how much extension can we get? Is there a stretch there? If there's a stretch and you're not able to get those elbows fully straight, then we're going to play in that juicy nature of the stretch. We're going to exhale as we extend into it. Inhale as we let it soften. And with each one, we're seeing if we can get a little bit straighter without forcing it. Now, if you have good elbow extension, you're able to get those elbows fully extended and there's no stretch, I don't want to lock them out, but I do want to actively straighten them. And from here, we can do a little bit of rocking back hips to heels. Again, this should be not painful. And I want to notice the difference right side to left side. Now, once we're done with that, we can come off the wrists a little bit, roll them out, give them a little bit of love. We're going to come back into the quadruped so that we can now get into our pelvis, or actually, we got to get into our feet first. So coming back to our quadruped, nice spread hands, grounded palms. We're now tucking our toes, keeping those toes tucked. So that we're now going to assess the big toe as well as the rest of the toes. So I want that big toe nice and tucked. We're inhaling as we rock forward now, and exhaling as we feel the weight of our hips sink between our heels. And I want to specifically feel that load into the big toe joint. Inhale, we're rocking forward. Exhale, we're rocking back. And as you're moving back and forth, start to notice, how does the right big toe feel compared to the left big toe? Is one side stiffer, tighter, more restricted than the other side? The big toe is a major point to assess. There's going to be some difference between the two. So if you're not feeling it yet, it may take a little time for you to kind of develop the sensitivity to notice how one toe feels compared to the other. Once we get 5 to 10 reps, we're now going to let our heels roll out and away, and we're going to see if we can get our toes tucked all the way underneath to that pinky toe. We're going to do the exact same thing. Inhale forward, exhale as we feel the weight sink to our heels. And with those heels rolled out, we should feel that stretch through those lateral toes and a little bit to that lateral side of the arch of the foot. How does it feel different on the left side compared to the right side? Is one side tighter, more restricted? Does it feel more limited in its range of motion? Then, after 5 to 10 reps, we're then going to untuck our toes, and we're going to let our ankles go nice and flat to the floor. And now we're looking at the front of the ankle space. We're continuing with our nice exhale, hips to heels. Let those hips sink down. I want to notice knees. I want to see how close we can get our hips to our heels. Inhale, we're rocking right back forward. Now the things to notice, are we able to get both hips close to the heels, or does one hip not want to go as far? That can be an indication of some knee inflammation, so we want to pay attention to that. The other thing is the front of the ankles. Does one ankle sit higher off the floor? Are you able to get them both flat, or does one side feel tight, restricted, and won't sit down flush? That can be an indication of some immobility in the ankle joint, so we want to pay attention to that as well. If you're able to get hips all the way to heels, we can let the hands start to slide back as we come more into this deep kneel position. Again, continuing to rock out of it and to rock back into it. This is an assessment, so I want to feel, how does the position feel? Right side of the body compared to the left side of the body. We'll come back to our starting point in our quadruped, hands spread, toes tucked again. And now we're going to get into some pelvic tilts and movement through the spine. So coming back into that breath focus, that nice inhale into the belly. As we fill in that belly, we're going to let that belly open up to the floor. The pelvis is going to start to tilt to the floor, and we're going to get a big sway in our low back. As we exhale, we're going to draw that navel into the spine, and we're going to start to scoop that tailbone. If you imagine your sacrum is the palm of your hand placed right here in between the hips, your fingertips are your tailbone. I want to imagine that we're scooping and we're trying to point those fingers towards the floor. But I want this movement to kind of remain in the low back to start with. As you inhale, feel that belly inflate to the floor. I want to avoid any kind of pinch or pain in the low back. Exhale, feel that scoop. but we're only letting that movement go up into that low back area. How does this feel on your inhale phase, moving into lumbar extension? How does it feel on your exhale phase, moving into lumbar flexion? Is it tighter moving forward, or is it tighter on that scoop? And is there pinch? Is there some discomfort? Those are very important assessment points. Now we're going to start to let this movement move up the rest of the spine. As we exhale, scoop, I want to feel that movement continue to move up the spine to the shoulders. Once we reach the shoulders, we're pressing into the floor. Allow those shoulder blades to round over the top. We're going to let it continue to go over the top of the head. And we're going to try to touch our tailbone and our forehead at this imaginary point right in the middle. See if you can feel your core light up on fire. And then on your inhale, it's going to pull the pelvis to the floor. That's going to move each segment one at a time towards the floor. As it gets to the chest, let your sternum drop and your head will come up last. So we're exhale, scoop, feel that nice wave, move up the spine to the head. Inhale. Same thing. Can you start to feel that nice wave? Move up the spine, starting at your tailbone. And moving up to the head, one vertebrae, one segment at a time. And by getting this nice wave-like action, you might notice that there's some segments that feel a little stuck, a little sticky, and they don't move quite as well. So that's what we kind of want to assess. And where do you notice? Is it in the neck, thoracic area around the chest? Is it in the lower ribs, or is it down in the low back area? Those, again, are going to be good things to put into our notes. All right, last thing in our quadruped. We're going to walk our hands forward of the body. I want to try to keep the hips straight over the knees. However, if you are experiencing some shoulder instability or discomfort, this can feel a little vulnerable on that shoulder. So you're allowed to let those hips sit back a little bit in order to take some of the stress off your shoulders. But eventually, ideally, with good shoulder health, we can kind of walk out. This is where we want to get to eventually. Nice spread hands, grounded through the floor. I'm pushing into the floor. My elbows are active and straight. I don't want to let them get soft and passive. From this position, we're going to come back into that breath with the pelvic tilts that we just did in our quadruped. Inhale, feel that belly open up to the floor. Pelvis is tilting down. Exhale, navel to spine as we scoop. And what we're doing here is on that inhale, as the pelvis tilts down, we're noticing that the rib opens up, moves to the floor. We get this big rib flare. As we exhale and scoop, that rib is moving towards the hip. That core should kind of get tight and tense. I want to feel that tension in the core as we get into our child's pose, which we're going to do next. So on your next inhale, feel that belly open up. As you exhale, feel that scoop, that tense core. And at that point, we can start to drop our chest to the floor. Inhale, we're coming up. We're letting that belly open up to the floor. Exhale, scoop. Feel that core lock in as you start to drop and reach the chest to the floor. Now, as I'm moving to the floor, I want to keep this downward pressure in my hands with my elbows straight so that we feel this kind of mobility stretch at the shoulders, specifically feeling into that elbow pit or the armpit area. How does it feel right side compared to the left side? Does one side feel tighter and more restricted than the other side? Also notice your hands. Does one hand feel like you can push harder, feel more grounded? Do you feel that you have good pressure throughout the hand and fingers? And does the other hand feel a little less? Does it feel different? Is it harder to ground and connect to the floor?